We're going to be processing platelet gel using the harvest machine today, the Smart Prep 2. This is a 55-year-old male thoracotomy patient. What we've done is taken a 60 cc syringe of blood with already mixed in with anticoagulant. What I'm going to be doing is taking this cravat, and if you'll see the top of the cravat, you've got two holes. What we've already done is we've placed 2 cc's of anticoagulant on this side. What I'm going to do is place the patient's drawn blood into the red hole here. This is a red rubber plunger. We want to be very careful not to push down with too much pressure. Also, we want to make sure not to activate the platelets by exerting too much pressure. With the harvest machine, there's 2 counterbalances depending on the amount of blood that is drawn first. I have the option of the 20 cc or 60 cc counterbalance. With this case, we're obviously going to be using 60 cc. We'll see you in 14 minutes. Now that we're done with the spinning on the harvest machine, what we've already done is we've taken the syringes that come with it. This one is for the platelet core plasma. What's nice with this is we've got a series of 2 stoppers here on the syringe that will allow us, if we wanted to take those off, we can get a little bit higher concentration of platelets depending again on what type of case we're looking at. The second syringe is for the platelet-rich plasma. The third syringe holds our combination of calcium and thrombin, which again is the activator for the platelet gel. Now, a couple things to show here with this. This is going to be our red blood cells that have been dumped back into the waste part of the cravat. The top part here is going to be our platelet core. This white line right here is going to be our white buffy coat. It's going to have our major concentration of platelets and our platelet-rich plasma, which is the red underneath. First thing I'm interested in again is drawing off the platelet core plasma. And again, I'm going to leave the stoppers in and draw back. And at the point that we're getting air, in this case, we've got approximately 26 to 27 cc's of platelet core plasma. Platelet rich. What I'm going to do is put this in to that platelet core plasma again, that top coat. I'm going to pull back some of it here. And what I want to do is get that white buffy coat where all that concentration of platelets is. So I'm going to spray some of that back in. See how that comes off the wall there. And I'll continue to do this. I'll do the back side as well. And I can get a little better look to make sure that I got all those platelets. And just to make sure I get them all. In this case, we ended up with approximately 11 cc's of platelet-rich plasma. The other part that we've been speaking about is the activating process of the platelets here. And what we use to activate the platelets and start the degranulation is a combination of topical thrombin and calcium chloride, which has been mixed already in this syringe.